Good evening, everyone. I am going to present a case report on entropion correction by zones procedure. A 63-year-old female presented with the chief complaint of foreign body sensation in right eye, watering from right eye, and diminution of vision from both eyes from a duration of 6 months. This is the picture showing the patient's right eye. External ocular examination. Her uncorrected visual acuity, respectively in right and left eye, was 6 by 24 and 6 by 18. Her best corrected visual acuity was 6 by 9 partial and 6 by 9, respectively in right and left eye. And intraocular pressure by applanation tonometry was 16 and 14 millimeters of mercury, respectively in right and left eye. Her right eye lower lid was rolled inward up till the intermarginal strip. Lower lid laxity was present and the lashes were turned inward and they were touching the cornea. Her right eye conjunctiva showed mild congestion and rest of her external ocular examination was within normal limit, and also she had immature cataract in both her eyes. She was diagnosed to have right eye lower lid grade 2 involutional entropion with trichiasis, and in the management part she was given lubricating eye drops and was planned for right eye lower lid entropion corrective surgery by zones procedure after getting the routine investigations. The steps: under local anesthesia, lower lid tractional sutures were given using 40 silk suture. Then skin incision was made 4 millimeter below lash line from lateral canthus to junction of middle and inner third of lower lid. Then pretarsal part of orbicularis muscle was separated from the preseptal part and the lower border of tarsal plate was identified. After that, the overlying fascia was separated from the preseptal muscle by blunt dissection after separating the inferior border of tarsus from orbital septum. 3 cardinal sutures were given using 60 Vicryl, passing through skin, orbicularis, lower lid retractor, tarsal plate, orbicularis, and skin, thus reattaching the lower lid retractor to the tarsal plate, and remaining skin was closed using 60 Vicryl. These are the immediate post-operative picture, and the other one is 2 days after the surgery. These are the comparative pre and post-operative pictures of the same patient, and the post-operative result was that entropion and trichiasis got corrected and her symptoms resolved. Brief discussion. Each eyelid consists of the following layers from anterior to posterior: skin, subcutaneous tissue, then layer of striated muscle consisting of orbicularis oculi and levator palpebrae superioris, then submuscular areolar tissue, then the fibrous layer consisting of central tarsal plate and peripheral septum orbital, then the non-striated molar muscle, and then conjunctiva. Rolling inward of the lid margin is known as entropion, and it is of following types: involutional, cicatricial, spastic, and congenital. Involutional entropion is mainly age-related and it primarily affects the lower lid. The causes can be weakness or dehiscence of inferior lid retractors, laxity of medial and lateral canthal ligaments, and overriding of preseptal and pretarsal orbicularis. Grading: grade 1, where only posterior border of lid is rolled inward; grade 2, where lid is turned inward till intermarginal strip; and grade 3, where the entire lid margin is turned towards the globe, including the anterior border. Treatment: for temporary relief, lubricating eye drops, taping of lid, and soft bandage contact lens can be given. But the treatment is mainly surgical using Zones, V's, Biggs procedure, lateral canthal sling, or simply using the transverse everting sutures. The other types are cicatricial, which is caused either by trachoma, trauma, chemical burns, Steven-Johnson syndrome, ocular cicatricial pemphigoid. Spastic, where there is spasm of orbicularis due to ocular irritation or inflammation, and congenital, which is a very rare condition, and where there is dysgenesis of lower lid retractors or developmental abnormality of tarsal plate. Thank you very much.
So I think this is something which is not uncommon, right?
Yes, sir.
Senile
Yes,
entropion, and so I mean, what was the reason why you chose to do this technique rather than the other techniques? Was there some consideration given to any factor when choosing to do a Jones procedure?
So it was a grade 2 entropion, and in cases of moderate to severe entropion, Zones procedure has shown to be very effective. So,
Right. It is one of the alternatives, and
yes,
certainly it has worked in your case. Just a couple of comments, right? I think, are these pictures taken from a video, freezing video, or how were the pictures taken? Because some of the pictures are not very clear, in the sense that these were taken with a
phone.
Sorry?
Sir, phone.
On the phone, right?
Yes.
Okay. Because some of the pictures, I think, would have been better if it were taken with either with a more advanced camera or with some settings, and some of them had a lot of blood. So your presentation will be much better if you give some attention to the pictures, because that's very important in this case.
Yes.
And the identification of the retractors, how is that? Because once you're doing surgery, things are not as clear as the diagrams, right? So how do you identify that this is the lower lid retractors through which I'm going to pass the suture and attach it to the tarsal plate?
So when a patient looks up, then the tuck can be felt.
Yeah, right, absolutely. So it looks like a white band. The structures in the lower lid are not as well defined as the upper lid, because the whole lid itself is smaller, the tarsal plate is narrower. So, but again, once you feel the tug and the patient looks up and down, I think that's the way you